Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. Today I'm going to talk about testosterone, and this time about potential harms of doing testosterone replacement treatment, not for prostate cancer patients, but in general for patients that have cardiovascular disease. And patients that have prostate cancer are older men, and older men have cardiovascular disease and low testosterone, and this replacement therapy may be dangerous because of cardiovascular event. So here is the paper that was published in JAMA in November, the association of testosterone therapy with mortality, myocardial infarction, and stroke in men with low testosterone level. The importance of this study is the fact that recently there was a study that showed that men that were given testosterone, there was high prevalence of cardiovascular disease, and this study was conducted on patients from the VA system. Let's see now what were the objectives and the results of this study. The objectives were to assess the association between testosterone therapy and all-cause mortality, myocardial infarction, and strokes among male veterans to determine whether this association is modified by underlying coronary artery disease. So the study was a retrospective national cohort study of men with low testosterone level. The testosterone level was below 300 nanogram per DL. They underwent coronary angiography in the Veteran Affairs system between 2005 and 2011. And obviously, we talk about a very large number of patients that were looked at, 8,709. They started testosterone treatment median 531 days following coronary angiography. So that was after more than a year or almost 2 years after the angiography. And what they found was quite interesting. They found that at 3 years after coronary angiography, the cumulative percentage of events were 90.9 in the no testosterone therapy group versus 25.7% in the testosterone therapy group. The conclusion and relevance among a cohort of men in the VA healthcare system who underwent coronary angiography and had low testosterone level. The use of testosterone therapy was associated with increased risk of adverse outcome. This finding may inform the discussion about the potential risk of testosterone therapy. And indeed, the whole issue of giving testosterone replacement therapy to patients that have prostate cancer is controversial, but more and more we tend to believe that it's safe to give, contrary to previous beliefs, that it's safe to give to patients that have hypogonadism or low testosterone, are symptomatic, even if they have prostate cancer. And there are quite a number of review articles about the topics, and the conclusion is that most likely it is safe, but we need more information and we have to be careful. Therefore, they recommend for the patient and the doctor to sit down together, go over informed consent, and consider the benefit and the risk of having this treatment. And that's true about any treatment. The problem is that men feel that more testosterone is better, and that's true for patients that have low testosterone, but not necessarily men that have normal testosterone. So now that we have potential of having risk of dying more from heart attacks and cardiovascular events, we have to be a bit careful before we want to satisfy the appetite to have more testosterone. I hope this was interesting for you. This is an alert for you to discuss with your doctor when you do a testosterone replacement treatment. And again, it goes obviously without saying, but I'll say it anyway, that you need to individualize the approach to each patient, and you need to do very careful monitoring. And I would say you have to go to a physician that knows how to manage testosterone replacement. Thank you for listening. Stay well, stay informed, and if you have any question, please call us. Please write to us at info@pcref.org. Thank you.